Welcome to our today's episode. This is Rokel Show, and today we are going to dive deep into an important topic that affects millions of women silently and for a long time. And this is about fibroids. We will cover what fibroids are, their causes, the complications they bring, and finally, the different treatment options available. If you or someone you know has ever experienced heavy menstrual bleeding, unexplained pelvic pain, or difficulties with pregnancy, then this video is for you. So stay tuned as we break everything down in a simple and clear way. We begin by definition of fibroids. Fibroids are commonly called uterine fibroids, and which are non-cancerous growths of the uterus. They are made of muscle, fibrous tissue, and they can grow inside the wall of uterus within the uterine cavity or the outer surface of the uterus. Fibroids come in different types. The first type is called intramural fibroids, which grow within the muscular wall of the uterus. The second type is called submucosal fibroids, which bulge into the uterine cavity. And the third type is called subserosal fibroids, which project to the outside of the uterus. Then we have the fourth type, which is called pedunculated fibroids, which grow on stalks, either inside or outside the uterus. Fibroids can be as small as a seed, barely noticeable, or as large as a melon, sometimes making the uterus look like it's several months pregnancy. The good news is that fibroids are benign, meaning they are not cancer. However, they can still cause serious problems if left untreated. Then what causes fibroids? The exact cause of fibroids is still not fully understood, but research points to a combination of hormonal, genetic, and lifestyle factors. Number one, we have hormones. Estrogen and progesterone, the two main female hormones, play a key role. They stimulate the growth of fibroids, which is why fibroids often develop during reproductive years and shrink after menopause. The second possible cause is genetics. If your mother, sister, or grandmother had fibroids, your chances of having them are higher. The third possible cause is race and ethnicity. Studies show fibroids are more common and often more severe in women of African descent. And the fourth possible type are other risk factors. For example, early onset of menstruation, obesity, lack of vitamin D, a diet high in red meat and low in fruit and vegetables, and high blood pressure may all contribute. So while the exact cause is unclear, these factors combined increase the likelihood of fibroid development. Then what are the complications of fibroids? Some women don't experience any symptoms at all. In fact, many fibroids are discovered accidentally during routine medical checkups. But for others, fibroids can lead to a variety of complications. Heavy or prolonged menstrual bleeding is one of the complications. This can cause anemia, making a woman feel weak, dizzy, and tired at all times. The second possible complication is pelvic pain and pressure. Large fibroids might press on nearby organs, causing discomfort. The third complication is frequent urination. If the fibroid presses the urinary bladder. Then we have constipation if the fibroid presses on the rectum. We may also have back or leg pain if nerves are affected. The other possible complication is on fertility problems. Fibroids can block the fallopian tubes, interfere with implantation, or increase the risk of miscarriage. Then we also have pregnancy complications. Fibroids may cause preterm birth, breech positioning of the baby, or increase the need for a cesarean section. So while fibroids themselves are not cancer, their effects on a woman's health, comfort, and fertility can be quite serious. Then how do we treat fibroids? The choice of treatment depends on the size of the fibroids, the severity of the symptoms, and whether the woman wants to have children in future or not. The first treatment, doctors may recommend pain relievers like ibuprofen or paracetamol, iron supplements to correct anemia caused by heavy bleeding, hormonal therapies such as birth control pills, progesterone-releasing uterine devices, UIDs, or injections called gonadotropin-releasing hormone agonists, which shrink fibroids temporarily. The second option is non-surgical procedures. We have uterine artery embolization. This procedure cuts off the blood supply to the fibroid, making it shrink. Then still on non-surgical procedures, we have MRI-guided focused ultrasound. It uses high-frequency sound waves to destroy fibroid tissues without surgery. The third option is surgical. And we have two main types of surgery that can be made on a patient with fibroids. The first one is called myomectomy. This is a surgical removal of fibroids, preserving the uterus. And this is the best for women who still want to have children in future. The second option is hysterectomy, the complete removal of the uterus. And this is the only permanent cure of fibroids, but it can also end the possibility of pregnancy in women. Treatment should always be personalized. Some women may only need monitoring if their fibroids are small and not causing problems, while others may require urgent treatment if symptoms are severe. In conclusion, fibroids are one of the most common health issues affecting women during their reproductive years. While they are not cancerous, they can lead to significant complications, from heavy bleeding and pain to fertility and pregnancy problems. The good news is that with modern medicine, there are many treatment options available, ranging from medications and non-invasive procedures to surgery. If you suspect you may have fibroids, don't ignore the symptoms. Seek medical advice early. Remember, every woman's case is unique, and what works for one may not work for another. Thank you for watching this video. If you found this content helpful, don't forget to like, share, comment, and subscribe for more health education topics. Together, let's spread awareness and empower women with knowledge about their health. And with that, it's bye for now from Frokel Show. See you in the next video. Thank you so much.